So I wanted to welcome everyone to the Silence Mental Health Stigma webinar. Today's webinar will focus around stigma around mental health and how they can result in people feeling isolated and resistant to seeking support. Just before we get started, I just wanted to go over a few housekeeping items. If you experience any technical issues, you can email webinars@safecarebc.ca and someone will be happy to assist. I just want to remind everyone that this webinar is recorded and it will be made available on the Care for Caregivers website afterwards. This Care for Caregivers program is an initiative that's partners with Safe Care BC, the Canadian Mental Health Association of British Columbia, with funding from the Ministry of Mental Health and Addictions. And while we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. I want to start by recognizing that we are gathered on the ancestral and unceded territories of the First Nations, Inuit, and Métis people across British Columbia. We thank them for being good caretakers of this land and allowing us to be visitors on this shared territory to do good work. I'll do a brief introduction of our wonderful speaker today. So Linda Monk is the founder and director of Thrive Training and Coaching. She offers coaching, training workshops, and coaching programs and presentations to various government and nonprofit organizations with extensive experience in healthcare, emergency services, education, social, and public service sectors. Before I turn it over, I just wanted to remind you that we have an upcoming webinar on August 30th on vicarious trauma and vicarious resilience. So with that being said, I'm just going to stop sharing and just turn it right over to Linda so we can get started because I know we have a packed agenda today. And over to you, Linda. Let me know if there's anything that I can help with.
Sure. Thank you. Thank you for that introduction and welcome everyone. I'll just take a moment to share my screen and we will get rolling. Kanbo, can you confirm you can see one slide there? Okay, great. Thank you. Well, welcome everyone. Thank you for taking the time to spend this hour together. We're going to be focusing on silencing mental health stigma. I know that's a big undertaking, but we'll take a look at what can help with some of this. I just want to acknowledge that I did a previous webinar on April 24th on stress management for caregivers, and welcome back to those of you who may have joined that session. And I'm honored to be here again today as your facilitator. And thank you, Kanbo, for all your work behind the scenes, making the session happen. So in terms of who I am as your facilitator, I'm a registered social worker. I'm a certified life coach. I'm a mom to 2 teen boys and a beloved golden retriever. I'm a wife. And the reason I mention this is because when we look at our mental health, it doesn't happen in isolation. It happens in the context of our lives as healthcare professionals, as helpers, as caregivers. And the whole of our experience in our personal lives, our professional lives, and the world at large that we live in these collective times that are quite elevated in terms of stress impacts all of us. And of course, as healthcare professionals and frontline caregivers, you're still in what's been real and continues to be real about the COVID pandemic, which is having and will continue to have long-term impact on the mental health of people who have been on the front lines. So I just want to give you a chance to think about, as we spend this time together, it's really a chance for you to think about your own mental health. Quite often in the work that we all do, in the various roles that you have in the organizations and settings that you work in, the work is very other focused. It's about the needs of other people, the health and well-being of other people. Often we're focused on the mental health of other people. And this webinar is really an opportunity to think about your own mental health. And in so doing, we're going to look at stigma. Stigma is always an issue when it comes to mental health, but there can be some extra layers to stigma when talking about it in relation to being helping and healthcare professionals. And we'll look at some of the ways that we can work gently and over time and in the immediate moment as well with how and also why silencing mental health stigma is so important to us all. So thank you for being here, and I will leave time for questions at the end. If you have questions that come up during the session, please add them to the Q&A section so that Convo can keep an eye on them, and I'll be sure to leave some time at the end. This is an interactive session, so we'll do a poll, and I have a reflective journaling activity towards the end. We will not be doing any breakout groups, and we'll just kind of stay in our collective here for some shared learning. So I first of all want to just invite you to give yourself permission to arrive fully to this time together. You might just take a clearing breath to support you to arrive. Just an inhale and an exhale. Just allow yourself to settle in. We live in times with so many distractions, so much input, so much stimulation, so many sort of points of entry through social media and email and all kinds of communications and happenings around us, that it can take more effort to come into the here and now. It takes some real intention. And our breath is one way we can come fully present. We're not breathing in the past. Future breath is always in the here and now. And the present moment is really the optimal place for our learning, our replenishment. And it's something that as you move through your busy days, even just remembering that mindful moment of pausing can really help support your overall mental health. It's not a magic wand, of course, but it really can, those continuous and regular mindful moments can really support our resilience and well-being in the midst of it all. So we'll try our best to bring that here as well. I'm sure many of you know a lot about mental health, but I'm just going to do a quick overview to kind of get us in the same space around what we're talking about here. And the first thing I think it's important for us all to keep in mind is that mental health is our health. It's not some separate tangent that we have, our physical health, and we have, other aspects of our health. And then there's this thing over here called mental health. I really think of it as central to our overall health. It's all interconnected. And when we can think of it this way, we can also normalize that it's something we need to tend to, something we need to respond to on an ongoing basis. So what is mental wellness? There's lots of terms we use: mental health, mental illness, mental wellness, etc. And mental wellness is how we respond to life's ups and downs, personally and professionally, and we are all doing that. And it also includes how we think, how we handle our emotions, what's our emotional wellness. It impacts how we act, how we're thinking, what we're feeling, what we're doing, what our behaviors are. And it's an important part of who we are, and it has multiple meanings, and it's impacted by many factors. It's impacted by our circumstances, our stress load, our support systems, our genetics, and our own coping styles, and so forth. So mental wellness and mental health is a multifactored part of our overall well-being. So what is mental illness? This isn't the clearest graphic in the world, but it's a quick glance at when we have a mental health condition that has a negative effect on the way we might think, the way we feel, the way we behave. And it's something that is prevalent in our midst. It's in our workplaces, it's with the populations we serve, it's within our workplaces and families and society. There's things like anxiety, depression, substance abuse, other addictions, post-traumatic stress disorder, and this list, as we all know, can go on and on. And it's also important to consider in the type of work that you're doing that there are occupational hazards to consider too. And I just heard Kanval say that you have an upcoming webinar around vicarious trauma and vicarious resilience, which is fantastic. In helping in healthcare professions, there are some common occupational hazards, things like burnout, primary and vicarious trauma or secondary traumatic stress, compassion fatigue, moral distress, psychological injury. And this list can also go on, but these are some of the common ones that are unique to the nature of helping work. Burnout, of course, can happen outside of healthcare professions, but it is a prevalent mental health consideration and overall wellness consideration in frontline healthcare. And all of these are relevant to your mental health, to our individual and collective mental health. So one of the things I've been thinking about in preparing for this webinar, I was recently on Cortez Island last week up at Hollyhock on a writer's retreat. And I was on a beach walk and I was looking down. It was a longer walk than I imagined over some rugged terrain. And I was noticing all of these little crabs that I took this picture, sort of popping up out of these holes and from under rocks on the beach. And each time they popped up, sensing my presence, their crab claws would come out. And it made me think about how in a way, that's how it feels in society at large right now. We're all on this heightened alert. We've had all of the incredible stress and change and adaptation from the COVID pandemic. We have the impact of climate crisis that's top of mind with the wildfires that are burning in our province and Northwest Territories and other areas. We have all that's real in your workplaces with the overall job stress picture. There's a lot going on. I think we can all agree on that. And if it feels like it's taking extra effort to tend to your own mental health, to tend to your own happiness and joy and sense of balance and well-being, I think it's fair to say it's taking all of us some extra effort to stay connected to our resilience, to be hopeful and optimistic in the face of some very big challenges in our times and in our individual and collective lives. And it can even seem absurd to feel hopeful in the midst of such distressing things. And yet that's exactly what we need to do to be resilient and to tend to our mental health. So if there's times where you yourself might be feeling a little less in balance or a little more reactive, like at every turn you feel like your own, sort of survival clause as a metaphor here are coming out, to know that's probably true. We're in a lot more fight, flight, and freeze mode. We're in a lot more higher levels of stress, and that's playing out in terms of the population's mental health. These stats here actually are statistics pre-COVID, and these are from the Canadian Mental Health Association. And I share them here to show the normalization that mental health challenges are common and no one is immune to them. Any of us with the right combination of volume of stressors and perhaps lack of resources to meet those stressors, along with many other variables, can need support and deal with our own mental health needs. And this is just some quick statistics that in any given year, 1 in 5 people in Canada will personally experience a mental health problem or illness. Mental illness affects people of all ages, education, income levels, demographics. Again, no one is immune. There's certainly resilience and protective factors that an individual or a population might have. Approximately 8% of adults will experience major depression at some time in their lives. And what we're seeing in the statistics on mental health in this post-COVID era is that certainly things like anxiety and depression are increasing. Calls to crisis lines have increased exponentially. So we know that there's an overall rise in the general population, and we certainly know in healthcare, particularly around burnout and compassion fatigue, that we have seen and are seeing elevated risk and reported cases of burnout. And I don't need to tell all of you that. You're in the front lines, you know what the pulse is, you know how people are feeling. Doesn't mean everyone's feeling that way, but many people are certainly ebbing and flowing in that feeling of burnout and quite a bit of stress. And this last stat here, by the age of 40, about 50% of the population will have or have had a mental illness. So again, what's important about this is that it's not something that's sort of out there. It's something that's here. It's in our workplaces. It's in our lives. It's in our midst. And it's why it's very important to look at how we reduce stigma around it. And I'll say more about stigma in a moment. I think it can be very helpful to think of our mental health and each other's mental health on a continuum. That we have mental wellness, we have mental illness, and there's a big space in between. We can have a lot of mental wellness in our lives and then maybe go through something like the COVID pandemic, for example, and it might tip those scales. It might put some unrelenting pressure on us that makes our mental health something that needs more of our attention or makes it more challenging for us. And so just to think in your own lived experience at this time, where do you feel, and I'm not asking you to answer this, I'm just asking you to self-reflect, where do you feel you are on this continuum of mental wellness or mental illness or mental health challenges? And just to notice without judgment. Awareness is prevention. Being able to acknowledge for oneself and to normalize in our population and in our workplaces is part of our mental health well-being, and it's part of reducing stigma, is to have this as a normal part of our conversation, as part of the employee wellness in the workplace, and so forth. So I'd like to pause there and share a quick poll. And these are anonymous responses. There is no right or wrong to responding to these questions. It's just to get a sense here in our group. I'll just launch the poll. So the question is, how much attention and care do you give to your own mental health and wellness? I am proactive with my mental health and engage in daily or regular self-care practices. I give some attention to my mental health. However, I could tend to it more. I don't put any energy into my mental health as I'm always focused on helping others. My life and work are so demanding that I don't have much energy or time left for myself. And the last one is I'm not sure. And maybe you never really think about it and you're not sure. So I'll just give a moment. Thank you for all the responses coming in. And thank you for reflecting on this. I'll just give it another moment. Okay. Thanks, everyone. We have 75% of those of you who are here have been able to respond. So I'm just going to end the poll and share the results so that you can see them. So you could see here that the vast majority, 89% of people who are here are 33% are proactive with mental health and have regular self-care practice. About 56%, over half, give some attention to mental health, however, could tend to it more. And then 8% said life and work are so demanding that there's not much time or energy left over for yourself. And one person said, you're not sure. And there wasn't anybody who said that they don't put any energy in to their mental health. So thank you, everyone, for that. And I hope it's helpful to just get a sense in the collective of where this is at overall at the moment. So just invite you back to your breath. That breath that allows you to be here now, to be fully present in the moment. It can be helpful sometimes through your day to allow your exhale to be a little bit longer than your inhale. That helps engage the relaxation response in your mind and your body. And when we can take moments to relax, we really help to support our overall mental health. When we're looking at the mental health of healthcare workers and caregivers, Care for Caregivers really matters, and the whole organization, Safe Care BC, this whole series of webinars is all about care for caregivers. And just having that focus having education, professional development, support, conversation around care for caregivers is already a part of your resilience. And I just want to acknowledge that. And I also want to acknowledge that it's not always easy to care for ourselves, to care for yourself, when caring is a precious commodity, when caring is an occupational core, like it is in the work that you do. And the nature of the work is other focused. The nature of what you do when you get out of bed every day, and that can also be in one's personal life, caring for family members, and then at work, caring for patients, caring for clients and families, and so forth. And because of this, the impact on your mental health is in great measure related to the nature of the work you do and some of those occupational hazards that can be part of the work. The well-being and reducing mental health stigma is something that is important at the individual level, at the employee level, but it's also very important at the team and the organizational level in terms of overall employee well-being and the discourse around the mental health of employees. So stigma. Stigma is a word that's frequently used in relation to mental health. And I think it's important just to unpack it a little bit. What do we mean by stigma? Because understanding that helps direct us towards what are strategies that can help us reduce or silence stigma for ourselves and with and for each other, and then, of course, more broadly. I think that stigma, in a way, is something that can be in the shadows a little bit, and that when we can really shine a light on it, we already do something to reduce it. And that's what we're doing by focusing on this here together today. So what is mental health stigma? There's lots of definitions, but it's those negative attitudes or beliefs or stereotypes that exist in society. And that can be in the micro, in a given workplace, in a given family system, in a community, in a nation, in a culture, that exist surrounding mental health conditions and individuals who experience them. And it involves pervasive social biases, discrimination that people with mental health challenges often face. And the reason we need to really address stigma directly is because it leads to more marginalization, oppression, isolation. It can reduce people getting help because they don't want to speak up about it. And that can be particularly true among healthcare professionals and other helping professionals. There can be that stigma around believing it shouldn't be happening to us, or that can we still be seen as competent in our work if we're dealing with our own mental health? There can be extra stigma and extra barriers to acknowledging mental health among healthcare and helping professionals. So stigma is when someone sees you or sees another person, sees anyone in a negative way because of a mental health issue, that they're seen as less than, or they're seen as something is wrong with them, all kinds of different beliefs that can really just make it more difficult to speak openly and get help. And the discrimination piece is when someone might be treated in a negative way because of a mental health or mental illness. And these things can make mental health problems much worse. When someone feels shame or embarrassed or stigmatized, it really can just make matters worse when we really need that sense of compassion, care, understanding, normalization to really support our overall resilience and getting any help we might need along the way. There's different types of stigma. There's that what's known as public stigma, which is that societal view of mental illness, some of the prejudice and so forth that I just named. And it can be just beliefs around mental illness, that people with mental illness are unpredictable or unsafe or not capable of recovery, and all kinds of things that can really ramp up that sense of stigma. And a common belief that can leave people isolated is that mental illness only happens to certain types of people. For example, not healthcare professionals, not helping professionals, or not a therapist, or not a counselor, or so forth. When really mental health, this is part of all of our lives and well-being. There's that self-stigma where we can internalize feelings of shame or guilt if we're dealing with some sort of mental health challenge. And this can lower a person's self-esteem and really just reduce the likelihood someone might get help. This can be true for healthcare professionals if there's that fear of any kind of repercussion or judgment of stepping up and trying to get help. And of course, that leads out into a more structural or systemic stigma that can go on around mental health. So stigma can manifest in different ways, but social isolation is a big one where people will fear being judged, fear being misunderstood, or being rejected by others. And then that can further exacerbate one's mental health challenges. And then there's the barriers to seeking help. Stigma can really discourage people from seeking professional help. And it can really leave them fearing all of that judgment and just can cause people to shut down and withdraw and so forth. So stigma isn't just one thing. I was talking to one of my dear friends and long-term social work colleagues, Chris Leishner. She's a registered social worker, a counselor, a trauma expert. And we were picking blackberries together recently and making jam. And I was talking to her about this presentation. We were talking about stigma and what our experiences have been as social workers. And she's been a manager in a helping agency for years. She's worked in First Nations health and so forth. And she said, stigma is not just one thing. It embeds things like guilt, responsibility, and a sense of failure that can impact us in so many different ways. And we were talking, I said, Chris, hang on, I want to go write this down. I want to include it in my presentation, and hence it's here. But I think it's really something that is important to remember, that it isn't just one thing, and it isn't the same thing for all of us. And it's important to really shine a light and really think about what are our own biases, what are our own beliefs about mental health, how do we feel about the mental health of other people, how do we feel about our own mental health, because our own beliefs and ways that we might even internalize stigma, or how we might internalize some of the stigma in an organization. So for example, if we're working in an organization that maybe doesn't have enough resources, which is a compelling reality across healthcare, there can be this sense that somehow the failings of a system or the lack in a system becomes very personalized. Because as a frontline worker, as you well know, you can sort of be that lightning rod for other people's dissatisfaction about the failings in our healthcare system. And that can be internalized as a sense of shame or moral distress or stigma, and can really add to the stress as you go to work every day. And so there are these large systemic issues that don't just stay out at a systemic level, but they can be very internalized for oneself and in your interactions and work every day. So it's even more reason to protect. It's even more reason to have conversations around care for caregivers, resilience, mental health, because all of these elements are in our midst. I'll just share a quick story. When I was in my 20s, in the first 10 years of my social work career, I did a lot of crisis intervention work, suicide response work. I worked in child welfare, child protection in Ontario, and then I moved to the metropolis of Prince George here in BC, and later moved to where I've lived now for over 2 decades on Salt Spring Island. And I worked at the hospital in Prince George in the emergency department and ICU, an internal medicine unit. And in many of my roles, including child protection after hours and as a hospital social worker, medical social worker, I carried a pager. And when that pager went off, it meant I had to respond. Sometimes that was to get out of bed in the middle of the night to respond to child welfare call, or it was a page, while in the hospital halls, needing to come to emerge to deal with a difficult situation or to be with the family when someone was dying. Sometimes it was just to hand out taxi money in the lobby of the hospital. But the point is, for years, the sound of beeping put my nervous system, my being, on alert and ready for action. And a few years into this, I started noticing, without making the connection, that if I was driving and near a truck that was backing up and it would beep, I would start to feel my heart pound. Or when I was heating up my coffee in the morning, and the microwave went off, that sound of beeping would put me into, okay, I've got to get responding here. And I started being concerned about it, like, this isn't normal. And I wondered, should I be concerned about it? I wasn't sure. I wasn't sure whether to bring it up at work because I didn't want to be judged. I feared, if there would be question around how I could do my work when I knew I was competent doing my work. I just didn't know what to do with it. And I went to a conference, and it was on vicarious trauma and compassion fatigue. And the facilitator, her name Jeanette Ambrose at the time, this is many years ago, over 20, maybe like 28 years ago, something like that. And she talked about all these different symptoms of vicarious trauma and different symptoms that helpers and healthcare professionals can feel due to the nature of our work. And she talked about a heightened startle response and a number of other things, and how our nervous systems can be impacted and how our senses are involved. And I had this light bulb moment that this beeping sound and me feeling alert with trucks backing up and a microwave going off, that's exactly what was happening. That this connection between the trauma material of others, me responding to it at the sound of this beeping pager, was now hardwiring my nervous system with the sensory input of a beep to feel that response, which makes total sense when you stand back and look at it. And I decided that I wanted to get help. So I approached my employee assistance program at the time, and I went for some counseling and did some work to, unpack this. I didn't want to be alarmed for the rest of my life heating up my coffee, and I was able to deal with it. But if I wouldn't, I do remember that moment of hesitating, like, should I get help? Should I tell anybody this is happening? Because of fear of stigma or fear of judgment. And I'm sure that many of you can relate. There may be times where you might feel like you'd like to get some help or some counseling or talk to someone or deal with some aspect of your mental health as a healthcare professional and caregiver, and you might hesitate. And that hesitation can come for many reasons, but stigma is a big reason that we hesitate, and fear of judgment, and even our own self-assessment of who we are and how we should be coping and what should be happening to us and what shouldn't be happening to us. There's so much we carry around all of this. So I just wanted to share this as my own personal experience, and nothing bad happened when I reached out for help. I was supported. I went to my EAP, and I dealt with it, which I'm glad that I did. And actually, it made me understand my work a lot more. And it also made me take care more. It made me start to do things in my self-care that were part of self-regulation, that were tending to my central nervous system, that were about deep relaxation to counteract some of what was going on, and so forth. So it led to something very positive. Once again, I invite you to come back to your breath. And you don't have to answer this question. I just want you to come into self-reflection. Self-reflection is part of our resilience. Just think about, what's your experience with mental health and stigma as it plays out as a healthcare professional or caregiver, a helper of some kind. What have you noticed? What have you noticed about your own mental health? What have you noticed about getting support for your mental health? How you tend to it, how mental health is taken care of or responded to in your workplace, on your team, by your employer. Those are lots of questions, but just what's your own experience? I want to invite us in now on how we can silence stigma, or at least try our very best to reduce it. To silence or reduce mental health stigma, it ultimately takes a multi-leveled approach. What we can do as individuals, our own beliefs, our own reactions, our own proactiveness, our own compassion with what happens on our teams, with our day-to-day immediate coworkers and colleagues, how we talk about mental health, how we support each other's mental health, what goes on in the workplace, the system, the organization, around a culture of health and well-being for employees and professionals, including mental health resilience, what's going on in society, how we break down barriers to support, how we break down stigma at the societal level. And all of these areas have tasks and things we can do. And it's very important for us to try to overcome mental health stigma. And it's not an event, it's not a single moment in time. It's a process, it's a decision, it's all of those small actions we take individually and collectively over time. And it's very important to do this for healthcare professionals and within our systems of care because it impacts our quality of care, how we tend to our own mental health, our own well-being, our own stress management, etc., directly impacts the quality of care we can provide. We all know that. And it also contributes to creating a supportive, non-judgmental, compassionate environment for people who need to seek assistance and make it easy for people to seek assistance. This is in everyone's best interests. Yours, the people you serve, your colleagues, families, your workplace. And so how do we do that? It's not easy, but recognizing that stigma exists is the first step. And then saying, what can we do about it? What can I do about it? What can you do about it? And these are 6 ways I think we can silence mental health stigma. And I'll just talk briefly about each one of them. One is to acknowledge the humanity of helpers. That helpers are people, healthcare professionals are people, and you give a lot of yourself every day. And you probably give more than you even have to give on many given days. And so getting tired and burnt out and feeling depleted can be understandable. And when we recognize that helpers need their own support and need care, and care for caregivers isn't just a good sounding mantra, but actually a way of being, a way of working, a way of honoring caregivers and ensuring they have what they need. When we can acknowledge that helpers can hurt, when there can be pain points and suffering for helpers, as you witness all of the stories of others, then we can be very responsive and bring some compassionate regard to the mental health and well-being of healthcare professionals, of all of you and all of us. So just to pause and think about, how does that happen? How is the humanity of helpers and healthcare professionals really honored and celebrated and supported in your day-to-day, in your workplace? Or how could it be? Bringing compassion. Compassion is a word that's used a lot, self-compassion. I love the work of Dr. Kristen Neff on self-compassion. She has books and podcasts, and she's a very thorough understanding of self-compassion and compassion for others. But it can be, sometimes the work asks us to push ourselves. You work long hours, you give a lot. Sometimes there's not a lot of breaks. There could be a lot of overfunctioning, overtime, trying to fill in gaps for an under-resourced system. So there could be a lot of pushing and a lot of pushing beyond. And sometimes it might not leave enough time for that filling your own cup and replenishment. And so when we can really incorporate self-compassion, today I did my best. Today I gave it my all. Today I cared for the people that I'm serving. And just really to come into that heart-centered, self-compassionate, and kind place with yourself. Today I feel tired, and that's okay. I'm really feeling stressed, and I'm going to nourish myself. But just all of that self-talk, self-kindness, self-caring energy that you can truly pour into yourself and also receive from others. Who supports you? Who cares for the caregiver? How do you let your family support you, your friends, your colleagues? And as healthcare professionals and caregivers, often we're very good at affording compassion and care to others. That's what we do in many different ways. And then how do we bring that to ourselves in big measure? Doing that helps reduce stigma. Because when we hold ourselves in a self-compassionate way, we are meeting ourselves as we are accepting that, we are not judging it, and we're resourcing ourselves accordingly. A third way that we can help reduce stigma is to set a positive self-care example. And when we prioritize our own self-care and we demonstrate that it's important and we take care of our mental well-being as a necessity, we're really openly valuing our mental health. And we are reducing any myths that self-care might be a sign of weakness or that self-care is something we should feel guilty about. And I mention these two things because I've worked in the burnout prevention field for over 25 years in one form or another as an educator and coach and so forth. And those two myths of self-care are prevalent, that self-care can make people feel guilty, and it can also make people feel like that if they need so much of it, maybe it's a sign of weakness, or if they need rest, maybe these sorts of things. And these myths can kind of take on a life of their own, and they can even become a bit martyrdom, like, I've worked X number of overtime shifts and it's like a badge of honor, or I haven't had a lunch break and I can't remember how long, as if sometime how this over functioning and not taking care is somehow a badge of great accomplishment, which we are accomplishing something, but we're at a cost usually. And so we have to be careful what we do around self-care, how we think about it, how we promote it and support it with others, how we acknowledge each other. I really like how you take a lunch break. It really role models to the rest of us. It's important to pace ourselves. Just how we language and think about self-care will be in great measure also how we think about and language mental health and how we promote or reduce stigma as well. So it's all interconnected. We want to reduce barriers to support. If we consider some of our self-care practices as healthcare and helping professionals to include getting counseling, having therapy, engaging in peer support and reflective practice, and maybe things like journaling. I'm a big promoter of journaling. I have a whole organization called the International Association for Journal Writing, and I teach a lot about the therapeutic value of journaling for helpers and healers. But when we can reduce barriers to the types of support we might want to and need to access, we really challenge and push back on the myth that seeking help is somehow, again, a sign of weakness or only something other people should do. We normalize it. So when we talk openly and have good awareness about, for example, employee and family assistance programs, when we have peer support teams, when we have team building events that are about generating peer support and good, healthy workplace culture, All of these things help to reduce stigma because we normalize that these healthy things are very important to do. And there's many ways we can do this, but people are more likely to seek help when we reduce the barriers to support. And that includes talking openly about what support is available and how it's very important to access it when we need it. And even as a proactive and preventative piece, we don't have to wait until we're completely burnt out or suffering to go, for example, and get counseling or support. We can do that as part of our mental health resilience in a proactive way. When you think of all the stressors and all the elements that are the nature of your work, having counseling, peer support, good skilled coaching conversations is all part of what can support you to do the meaningful work you do in the world. A fifth strategy is to increase mental health awareness and education in the workplace through webinars like this, through ongoing professional development, through employee wellness initiatives, where mental health is part of the landscape, part of the conversation. People are increasing their understanding about it because when awareness goes up, understanding goes up, compassion goes up, stigma. There's a direct correlation between those things. And there's lots of things that you can do. For example, you can celebrate Canadian Mental Health Week in your organization and in your teams for yourself. It's coming up again in May 6th to May 10th, 2024 is Mental Health Week here in Canada. You can go on the Canadian Mental Health Association website. I'm sure you have lots of mental health resources available in your own workplaces. But again, as it becomes just an ongoing part of the conversation, that reduces stigma and it builds awareness, which helps everyone. And lastly, and there are many things we can do, these are the 6 I've picked to share with you in our time together, is creating emotionally safe spaces where there's respect, where there's inclusion, where there's consideration around mental health, and there's really a prioritizing of employee health inside of the overall organizational health priority and vision. And when we're part of what feels like an emotionally safe environment, that helps protect. That's a resiliency factor for our mental health. So I invite you to take another breath. Just think about how these various ways of silencing stigma could be helpful to you, can be used and embraced in your workplaces, in your lives. And I want to give you a chance to pause and reflect here before I move on to some Q&A. But one thing is to remember that your mental health and wellness is more than your mind. Our mental health involves caring for our whole self, our minds, how we think, our bodies, our physical activity, our rest, our hydration, our nutrition, our heart, our emotional health, how we give and receive care, our spirit, how we nourish that part of us, our essence, how we connect with nature, how we connect with our own joy. So it's our whole self. And I want to give you a couple of minutes just to pause and reflect. I mentioned I have a passion for journaling for self-care and mental health. And in the description of this webinar, I asked for you to please bring a pen and a paper or a notebook. And even use a napkin if you need to. I'm going to do what's known as a free writing. So whatever you write is right. There's no right or wrong way. Before we start, I just invite you to close your eyes or lower your gaze. Just come back to your breath again, noticing your inhale and your exhale. Noticing the seat beneath you, supporting you, holding you in the here and now. And from this present moment place, I invite you to open your eyes, raise your gaze. And there's 3 prompts to pick from. You can always take a screenshot of these and use all of them at some point, but I invite you just to pick one. First one, what do I need for my self-care and mental health at this time? Or I feel at my best when. Or write a self-compassionate love letter to yourself. So if I was writing it to myself, I'd address it, Dear Linda. And what might I want to say to myself that would be affirming, compassionate? What do you need to hear right now? So just pick one of these prompts, write them down, and I'm going to set a timer for 2 minutes, give you a chance to respond to it. And I'll leave a few minutes for questions as well. Just keep your pen moving. Listen to your own inner wisdom. Stay connected to your breath as you write. Writing begins with the breath. Thirty more seconds. Just finish up the sentence that you're on. It's okay if it's not complete. You can always come back to it. And just sort of shake that off. Journaling is a physical act, an emotional act, cognitive act. And I invite you to take those pauses when you can. I hope you enjoyed that. Just some final words and I'll open it up. I love this quote, the Buddha. You yourself, as much as anybody in the entire universe, deserve your love and affection. When I think about self-care, I always think about, how would we treat ourselves as someone we really, really love? And that question can really point us to self-care that really can protect and nourish our mental health and our overall well-being. Making sure you take time for you to do things you love, that bring you joy, that uplift you, that tend to your health, your well-being. And not just once in a while or on a holiday, but in that 15-minute break in your workday, lying in bed before you go to sleep, thinking of what you're grateful for, really choosing things that nourish you and give yourself time for yourself. I also think it can be very helpful to have an affirmation, a real declaration around your own mental health. So maybe it's something like, today I take care of my mental health with self-compassion and non-stigma or non-judgment towards myself and others. And you can write this down, put it on a Post-it note, put it in your calendar, put it on a screensaver. Just keep those really affirming messages about your own mental health and well-being and that of each other up front. And we know why this matters. And once again, just to remember that your mental health is your health. And I'm going to stop there and open it up to questions. And before I do, I just want you to take this image with you. This is a quote by Glenn Close. She says, "What mental health needs is more sunlight, more candor, and more unashamed conversation." And I just want you to imagine or actually take in the form of opening up your arms and just imagine the sun pouring in and through the top of your head, down through your whole body, filling every cell of your being, out through the soles of your feet. And just really allow yourself to receive any nourishment that you need in this moment and the next. And I sometimes will just stand like this in my office or out in nature in the trees or by the ocean and just stand and allow what I need to pour into me. It's something you can do on a regular basis to uplift, and I hope you might find it helpful. So, Kanval, I'm going to turn it over to you. I know we only have a few minutes left to see if there's any questions or comments.
Absolutely. So if anyone, oh, there's just some thank yous coming in, which are so wonderful to see. If anyone has any comments or questions, please pop them in the Q&A box below. Also, this webinar recording will be available on the Care for Caregivers website. And as well, we do have Linda's bio and contact information as well on our website. So if there's any further questions or things that you wanted more information on, please, can you back up to okay, they're saying, can you go back 2 slides?
Is this one the right one, Sherry? I think that's 2 back.
I think so too, yeah. Again, I know I'm being mindful of everyone's time. I know everyone has a tight schedule. Thank you so much to everyone that attended the webinar. Thank you so much to Linda. Linda, this was so even wonderful for just even taking a small piece away. And I love the part that you talked about being proactive and not waiting until, you know, we really need that support and building that into our regular lives, and something we don't really think about. I think that was a big takeaway for me and something I'm definitely going to apply. So thank you for your time, Linda. So much appreciated. And thank you to everyone for attending. Again, because it's a short time, we're going to end the webinar. But if you have any further questions, please email the webinars at SafeCare BC. And this webinar, as well as Linda's information, will be available on the Care for Caregivers website. Please take some time to complete the survey. It will be available once you exit the webinar, and it'll also be emailed to you at the post-webinar email. So thank you, everyone. Have a wonderful rest of your day. Thank you, Linda. And
thank you, Kanval. Thanks for being here, everyone, and take good care. Thank you for the work you do in our world. It makes a difference.
Thank you. Bye, everyone.